COVID-19 cases and 31 deaths. The National Institute for Communicable Diseases reports the 319 new COVID-19 cases brings the total number of laboratory-confirmed cases to over 2,923,054. This increase represents a 1% positivity rate. Now, Dr. Nicholas Crisp is Acting Health Director General, and he joins us to talk to us, to give us a further update. A very good evening to you, and thank you so much for speaking to us. Firstly, if you can confirm those numbers, if they're still the same, but also the Health Department says 63,000 people were vaccinated on voting day, despite it being a public holiday and election day. Just how far are we in terms of our target of 67% vaccination?
Good evening, Tapisa, and hello to the viewers. So those are the figures we're seeing, more or less 300 cases a day, and the deaths fluctuate as well. So they're substantially less than we have been seeing, and we're very happy that they are down. Of course, those are the reported diagnosed cases. It doesn't mean that's the only transmission that's taking place in communities. As far as vaccinations are concerned, yes, you're right. We recorded just over 63,000 vaccinations on election day. And that was, not as good as we would normally expect on a normal day, but as good as any weekend day. And considering that many healthcare workers returned to their homes for their own voting, it was not disappointing, but a little bit lower than we had hoped. We'd hoped to get closer to the 100,000 mark on the day. Today, we crossed the 23 million dose mark, total doses. That's over 12.7 million people adults have been fully vaccinated, which is about 32%, which is obviously far off where we would like to be. But the good news is that in our population over the age of 60, we have now in excess of 55% of that population totally vaccinated. And in the 50 to 59s, we breached the 50% mark today. So that's another milestone that is also very important to us, because these are the most vulnerable people for severe infection.
And not to be dismissive of what you're saying, though, but it's still not herd immunity. The WHO Africa recently is saying that less than 10% of countries on the continent will reach 40% of vaccination. That's not even meeting herd immunity projections or at least objectives. What is the major hindrance?
Well, nobody even knows what herd immunity means anymore, because the virus tends to mutate quite frequently. And I think the herd immunity is an elusive goal, but it's still way fewer than we would like to vaccinate. That's the honest truth of it.
So are you saying it's no longer the 67% that we were told?
It's probably need to be 85 or 90% by the look of things. So I think it will be years before the world gets to, and certainly countries like ours, get to herd immunity. We've seen countries in the north that are months ahead of us in vaccination who've had even 80% vaccination and more, and that has still been insufficient for them to completely stop the transmission. So, and that's what you try to do with herd immunity, is stop transmission.
So what are you learning then in terms of the evolution of the virus? Is there new scientific studies? Because I know you do that periodically. For instance, you talking about wanting to meet the demand of 200,000 vaccinations per day or more. What is the major impediment? Is it still supply and demand that is the major kink? What is going on?
Yeah, so supply is not a problem at all. We have a lot of vaccines in the country still. There are around 12 million doses in the country at the moment. That's the combined doses of Johnson & Johnson and Pfizer. So we don't have a supply problem as far as vaccines are concerned. We don't have a supply problem as far as the consumables are concerned. And we have, between the public and private sector, still got capacity to vaccinate 300,000 people a day. So supply is not our problem. Demand is the challenge. And we are seeing fewer and fewer people coming for vaccinations on a daily basis. We're not even getting to 200,000 a day at the moment, which is deeply disappointing, because we are doing far more outreach and far more information is available, and the sites are all still available. So I think that the public is now just getting tired of hearing about vaccinations the whole time. We are tending to let our guard down because we are out of the third wave. And this is really not good news. We need to, all of us as society, continue to wear masks, continue to wash our hands, continue to maintain social distancing, be very careful of large crowds and spaces, keep in ventilated areas.
So, Dr.
and
Chris,
we
let me
have to
jump in there.
increase
You talk
vaccination.
about be careful of large crowds and spaces. We've recently just come out of an election. That was unavoidable, wasn't it? So we really don't know who was vaccinated, who wasn't, even if we're following health protocols. When will we know if there's been a spike in COVID-19 infections, particularly as a result of that? And there's often constant talk of a fourth wave recently. Is there scientific evidence that this fear is real?
Yeah, so the question of crowds is actually in the pre-election period. Election day itself is far better controlled than the politicking that happens prior to an election. So that's obviously a risk period that we're always concerned about and that we must watch. And we should see whether there's an uptick in the next 10 days or so that would be indicative that there has been transmission because of those crowds. Will we get a fourth wave? Yeah, almost certainly we'll get a fourth wave. And our various modelers and scientists have looked at a whole range of scenarios of what would happen. If we continue on our current vaccination trajectory and continue to behave as citizens as best we can with the masks and so forth, it is, and provided we keep with the same variants we have experienced up to now, we will get away with a very light fourth wave.
And when is that projected to be? From the modelling here and abroad, when is that expected to be?
Well, they seem to be a couple of months apart. So we've always said it will be towards the end of November or December based on the trends we've seen up to now. So the timing is that it will probably be during the month of December. But it's the size of the wave that's going to be the challenge, and whether we have sufficient people who are of risk, who are vaccinated, is really whether our health system will bear up again. And if we don't get a change in a variant and a more aggressive variant, we will still see a wave. I don't think there's a doubt about that, but it'll hopefully be less aggressive and less destructive, specifically than the third wave, which was extremely destructive.
So you are talking about COVID-19 fatigue and the fact that the goalposts keep changing. So herd immunity no longer 67, it's 80 and above. Then there's a prospect of a fourth wave. If we don't get another variant, we should be fine. But ultimately, are we talking about definitely needing booster shots? Because the COVID skeptics will be saying, what is it now? You say, get vaccinated, get one shot, get another, and then there's a booster shot. When does it all end?
Well, it's not going to end for a long time. I think we must learn to live with COVID for the next 5 years at least. This is the nature of what we're dealing with, I'm afraid. It was a big unknown. And, there were people who denied HIV when it arrived, and we're still living with it now and are starting to get on top of that pandemic many years later. So this is a different kettle of fish entirely. This is a droplet spread and aerosol spread virus that is reaching all of us all the time. So I think that we need to, and it's a virus that mutates pretty readily. So I don't think we are going to be rid of COVID for a very long time, and we need to prepare ourselves for that. We need to think differently about how we get on with our lives. And one of the things we do know for sure is that if you vaccinate, you definitely decrease your chances of infection and of severe infection. If you don't, you are likely to get sick. And if you are elderly or have any form of immunocompromised condition, you're likely to get very sick and perhaps die.
Well, thank you so much for your time, Dr. Nicholas Crispy is the Acting Health Director General. Update on the COVID-19 front, especially the rumours around a fourth wave and just how far we are on our vaccination drive. As the WHO Africa says, 10%, less 10% of the African continent will reach 40% of vaccination. Well,